Good? All right. My name is Alex Van Patten, and you're watching my attempt at ostomy care. First thing I want to do is go into my room, wash my hands, don my clean gloves, identify my patient, check against the order, make sure it's the right order, the right patient. I also want to assess bowel sounds before I start poking at anybody and doing any kind of violation measures. I want to let the patient know what I'm going to be doing. This could be his or her, it might be her first time getting this done, and it could be kind of creepy. So what I'm going to do is maintain privacy, pull back some stuff here. Look at this, she already has poop on her gown. It's horrible. Anyway. Okay. What I'm going to have here is the bag. Now, the first part of the skill is to empty a currently used bag and not replace it. So what I'll do is, with a bedpan over here, I think the fracture pan will work better as it's not, I have to jump the gap here and that can be messy. However, I'll work with what I have right now for taping, but a fracture pan would be ideal, or maybe even a basin. What I'm going to do is, if it's formed stool, I want to work it around, well, that comes later, I guess, but I'm going to open up the clip here, okay, and then if it's liquid stool, I'm able to just get it into the basin. We'll pretend it actually hits over the lip here. I'm not making an epic flood. What else I want to do is I want to check out the consistency of what I'm actually draining out of here. Is it formed or liquid? Any medications in it, or signs of blood, obvious blood. For the hard to reach or the hard to get out stuff, I want to, with the peri bottle, some warm water in here, slosh it around a little bit and kind of work it around. And then I want to drain that out and repeat as necessary until the bag is as clean as I can get it. When that's done, I want to dry off the end of this bag so I can get a decent seal with this clip, which is about to fall off after prolonged use. I only want to fold it the one time because it can actually interfere with the way the bag seals. And clip it like so. I can remove this, dispose of accordingly, clean up anybody that got poop on them or whatever else. So we should have a clean bag here, everything. And I might be able, depending on how clean the bag is, get a good look at the stoma to see if it's actually, beefy red and whatnot, and check for signs of leaking from the wafer. Okay, so that's the end. And then get your patient all ready to go, cover her back up and document accordingly. So that's the first part of just emptying the bag. The second part is going to be then to actually change the bag. So we'll go back to where I was with the clip off. This is how they get broken too. I take them off 10 times. Okay, so we're back to this part. The bag's been cleaned out. What I'm going to do is detach the bag like so, and I'm going to dispose of the bag here. But we're not going to put it on the other bag because rumor says that the bag doesn't fit the new. They're not compatible with the demonstration. So I would remove the wafer as well, but we're going to leave it on for the demonstration and for the integrity of the mannequin in the future of all nursing students. After that's off, I want to clean around it with warm water, blot dry, and then I want to, with the clean, I want to assess the stoma for the color, the shape, peristalsis, should be beefy red, anything draining out of it that shouldn't be draining out of it, blood. And I'm then able to see it's been cleaned. I assessed it. What I want to do is measure. Too much pretend. Okay. What I want to do is I want to measure the stoma. I'll use this. I prefer the template, but I couldn't find one. So I'm going to put it over here. It looks like 3 centimeters. Appears to be the diameter of this. So what I'll do is hone my scrapbooking skills. I'm going to transfer that. Go away. I got a pen right here. Okay. So, center the hole up here, and I'm just going to draw over this. It'll make an indentation on the other side, which I can trace over again and cut. Okay. Oh, that's horrible. I'm not even going to lie to you. Okay. Get my scissors out here. Thought about getting some scrapbooking ones with the little wavy lines on them. Make it festive. And I'm going to cut this out. When it's on the patient, I want to have no more than 1/16 of an inch of gap between the edge of this and their skin. And since I'm cutting like a left-hander using a right-handed pair of scissors, I've got yucky corners, and I'm going to use my finger just to kind of mash them down a little bit so it's not sharp. Okay. Now I would peel the back of this off and then place over the stoma. I'm not sure. I won't be able to get a tight fit because of the way this is, but you know, if it needs to be done more, I can cut around a little bit more, or I can kind of push it down a little bit so it stays nice and snug, and we're 1/16 of an inch away. With that on there, while I was cutting that, I do want to have something over the stoma so we're not having a volcanic eruption of things. And to prevent those kind of eruptions, we would do this an hour before mealtime or 3 hours after mealtime. So then with the new bag, this is the old one, with the new bag, I can then place this on. What I want to do is hold it, do the Tupperware snap here, and I want to hold it on for about 2 minutes so the adhesive on the wafer will warm up with my hand's warmth and then adhere to the skin. When that is full, fast forward 2 minutes here, and then I can reapply the clamp with just the one fold, actually this way. Okay, so we got clean bag, clean wafer. I saw someone had theirs signed. I could always do that. Throw my name on it so people know when I did it last. Make sure the patient's okay. I can reassess bowel sounds if I'd like. Bring this away. I guess I just had it there for, I suppose with everything all cleaned up without the bag on, I could not have to have the base in there. If I had the paper towels over it, it wouldn't hurt to have something to catch things in. And I can cover up the patient, put the bed back down all the way, and ask if she has any questions, put the call bell in reach, and run. Thank you.